Hey there, welcome back. This week we're going to be talking about patient recruitment and sort of some of the pitfalls you can run into, and obviously some of the regulations in ICH as well as the code. And this is important because a big part of your job as a research coordinator is to find patients. Recruiting patients can be incredibly important. If you don't have patients, you don't have data, and if you don't have data, you don't have a happy sponsor. So let's talk about some of the good and the bad and the ugly about patient recruitment. So some key points I want you to bear in mind when we think about patient recruitment is that the FDA considers the recruitment to be the very start of the consent process. We talk about the consent process in almost religious terms because everyone's really aware that this is important. You have to do it right. But the FDA actually has said in their guidance documents that they consider this to be the very first conversation that you have with a potential participant, and that this sharing information with them is the very beginning of the consent process. So bear in mind that this is going to be really important. When you're using ads to find participants, you have to be very specific and very careful with the language because you don't want anything in your advertisement to be considered coercive. We'll talk a little bit later about what exactly that is. And you have to remember that when you're paying people to participate in a clinical trial, that whatever you give them is not a benefit of participation. That whatever you give them, it's oftentimes money, but it could be other incentives. Whatever incentive you give them is a tool to recruit. It is not a benefit of the study. So you have to be really clear. You want to make sure that they understand why you're giving them that money. You're giving them that money so that you entice them to be on your trial. So let's talk a little bit about money and incentives, since I just mentioned that. Amount of payment and how you disperse that money has to undergo IRB review and approval, so that you make sure that nothing you're doing is coercive or has any kind of undue influence on whether people participate in the trial. So again, the payment, whether it is money, and oftentimes it is, but it could be other incentives. It could be bus fare. It could be subway tokens. Well, that wouldn't happen in San Antonio, but depending on where you live, it could be movie theater tickets. It could be cab fare. It could be anything that maybe isn't direct cash. But whatever you have that you use to incentivize your participants, it has to be reviewed by the IRB. And this is found in the CFR and ICH if you'd like to go and read those regulations. But this is required. All information concerning payment should be clearly included in the informed consent document. Remember, the consent form has information that is important for people to know as they consider whether they're participating in a clinical trial. And especially for healthy volunteer studies, what you're going to pay them is part of the consideration. It's a bit of information they'll use to make their decision. So it has to be in the consent form. It has to include the amount that you're going to give them, or whatever the item is, and what schedule are you going to give it to them. And the schedule gets to be really important when you think about it. The schedule and how the incentive is dispersed really should not be at the very end, the very completion of a study. Typically, a portion is given as an incentive along the way. So what you don't want to do is you don't want to say, participant A, you're going to be on the study for 6 weeks. And at the end of 6 weeks, we're going to give you your payment. That would make really good sense from a retention perspective, because if that participant doesn't complete their 6 weeks, they don't get paid. So you will find participants that stay on the study. However, two bad things can happen there. It's good because they don't leave prematurely, but it's bad because A, you are putting that participant in an awkward position. The greater the incentive, the more likely they'll stay for those 6 weeks, even if they don't want to be on that study anymore. So by giving them one lump sum at the end, you're not respecting the autonomy of that individual. The other bad thing that can happen is if you keep someone on a study and you induce them to stay till the very end, oftentimes those participants will not tell you certain specific adverse events because they don't want to get kicked off the study before they get paid. So in a way, you're incentivizing the participants to withhold really important research findings from that study. So it creates a really awkward situation, and it's really bad practice. So most places will allow for a payment to be made at the end of the study, but at certain milestones throughout that period of time. You don't want to have anything that appears to be coercive. So we'll pay them, but what are we going to say in the ads to find them? You cannot say anything in your ad that is a claim about safety or efficacy. Now, that investigator's brochure will have all sorts of things in there that will be helpful for you as the coordinator to know what is going on with other people that have been on the study. You'll know the adverse events, you'll have an idea of just how efficacious it is, and this information will be in the consent form. But you can't make a claim yet because the FDA hasn't approved the language about safety or efficacy. You also cannot make a claim regarding equivalency or superiority to any other drug. So if you were involved in clinical trial of an antihistamine during allergy season, in your ad you couldn't say anything that it's as good as or better than Claritin for allergy symptoms. That, according to ICH, creates some coercion. And it violates regulations regarding promotion of investigational drugs. 312.7a is very clear that drugs that have not been approved by the FDA have to be clearly identified as investigational. And you really can't use terms, new treatment, new medication, new drug. You cannot use those terms because that implies that it's FDA approved. Once the FDA approves it and it's available for prescription or over-the-counter distribution, then you could say it's a new treatment or new medication. But you can't say it yet because it's not been approved. Now, there's a little bit of a caveat here that I want you to think about. These terms are permissible only if you also use the term investigational. Because if you go up to 21 CFR 312.7, that I referenced just a bullet point or two ahead of this, we have to say it's investigational. So you could say a new investigational drug, that would be fair. New investigational medication, new investigational treatment, that would be okay, but you have to have the fact that it's investigational, it's not approved by the FDA, clearly marked in your ads. So how do you advertise and how do you inform? The IRB, remember I said earlier, the IRB is going to want to approve this whole process, including the payments. When does the IRB have to review it, and when does the IRB not have to review it? I want you to think of sort of advertising and then informing, and I'll get to this very nuanced difference here in a minute. So the IRB review has to happen under these circumstances. If you're going to put an advertisement in a newspaper, yes. If you're going to put an advertisement on the radio, yes. TV commercials, yes. Bulletin boards. Now, if you go to any college, undergraduate or graduate that involves clinical research, such as the Health Science Center, they'll have student bulletin boards where they'll be looking for participants for clinical trials. And then that would require IRB review. Posters and flyers, right? All of these things, you are clearly using any of these methods to find participants for your clinical research trial. The IRB wants to know about it. The IRB wants to look at it. And while I'm on this topic, the IRB is going to want to look at it in the format that you're going to give it. So when you say to the IRB, I want to put a newspaper ad, they're going to want to see exactly what it'll look like in the newspaper. If it's a radio advertisement, they're going to want to know exactly how it's going to sound, because the IRB wants to review it from the perspective of a potential participant. And so they're going to want to see it in the format in which it's going to be distributed. Now, the IRB does not need to review it under some certain circumstances. when the advertisement is intended solely for health professionals. So if your site were to have a newsletter, monthly, quarterly newsletter that you send out to referring physicians, and it's intended for the referring physicians, then that does not need IRB review. This is communicating to someone other than a participant. Sponsors will oftentimes have, especially the pharmaceutical companies, they'll have really nice news stories. They like nice press about some of their drugs. A news story that is a news release by a sponsor does not need IRB review. Publicity intended for other audiences, whether that is a sponsor approved poster at a symposium, then that doesn't need IRB approval. Also, your sponsors will oftentimes publish information for investors. That's another audience that the IRB does not care about. Internet listings, and oddly enough, the IRB does not need to review internet listings when some criteria are met. So we'll get to that in a second. So you can see the IRB wants to review things that are designed to target potential participants, but the IRB does not want to review things that are meant for other audiences. And the internet listings lives in sort of both of these worlds. So let's talk about the internet listings and how they sometimes do not need IRB review. The IRB has to review and approve internet listings, but it's not required, that approval is not required when the format is limited. And so if you in your research site were to have listings that met these criteria, you would not have to have the IRB review and approval. The study title, the purpose of the study, a very short protocol summary, basic eligibility criteria, study site locations, if there's more than one, and the site contact information. If this is the limitation and this is all that's available on an internet web page, then the IRB does not need to review and approve this. Now, I'd like to put a caveat in there that if you're not sure and you have a sponsor that wants to, they want an internet listing, you could really contact your IRB and speak to them and talk to them and see whether you do or do not need approval. But if you just had these few things, then you'd be okay. Clinicaltrials.gov, I want you to go to that website and I want you to look, and you'll see this exactly what's on here. Clinicaltrials.gov is a monster of a website, and you could go and you could find a clinical trial. I found a lot of clinical trials that are in process and that are actively recruiting people here in San Antonio. And the clinicaltrials.gov website really limits all of the internet information to these 6 bullet points. If you really go beyond this, then you're going to want the IRB to review and approve it. But if you limit yourself to these few things, then that's perfectly fine. Again, talk to your IRB if you're not sure. So some questions come up, and these are always interesting kinds of things when you talk about patient recruitment. We talked about incentivizing participants, but what happens if a sponsor offers incentives to investigators to increase enrollment? Does the IRB have to review and approve this kind of practice? I will tell you it's really uncommon, but I have seen, I have heard of sponsors sometimes giving incentives to the investigators or to the research coordinators or to the individuals that perhaps are involved with patient recruitment. And typically, healthcare providers will not accept incentives to increase enrollment. The American Medical Association frowns on this. There are no laws against it, but it tends to not look very favorable. The IRB review and approval, I would actually call them and ask them. This is a really uncommon kind of situation, but I sort of had this question in here to sort of highlight that sometimes you're going to come up across some really sort of uncommon scenarios, and this is one of them. Personally, I would never accept an incentive to increase enrollment. I personally find that it almost implies that I'm not doing my job unless I'm incentivized. And most professionals feel that they are doing their job because it is a job to do, and they do the best they can at it. So I would not accept it, and I doubt that an investigator would accept it either. So here's another question. When investigators seek patients from sources outside their practice, and for example, this would be professional networks, other professional peers, patient advocacy groups, is IRB review and approval needed? And so when investigators sometimes look for patients outside of their own practice, I mean, this happens, it's not terribly uncommon. Is IRB review and approval needed? And I say no. And here's why not. Because the IRB review and approval is really needed when you are directly trying to contact potential participants. In that case, IRB review would be needed. However, when one doctor in one practice contacts another practice to potentially get some referrals, that is a physician-to-physician discussion that's happening, and that is happening outside of the purview of potential participants. So I say no, that is not necessary here. And then when a prospective participant calls your clinic in response to an advertisement, is the information provided by the study staff during that call subject to IRB review and approval? So you'll have this. You'll have an ad out there, and you'll say, contact Heather McCreary at this number, and I will start getting calls from people who are potentially interested. The information that I provide to that person on the phone is not subject to IRB review and approval, and here's why. The information that I'm going to give to that participant is the information that's in the consent form. I'm not going to read the consent form to them, but I'm going to give them the same information that I'm going to give to them when they come in and review a consent form. That's already been provided, and it's already been approved by the IRB. I'm not giving them any information that's not in the consent form. Of course, this is a conversational kind of style, but I'm not going to give them any additional information. Every caller is going to have different questions. Every caller is going to want different information because everybody makes decisions a little differently. Sometimes I call, sometimes I receive calls, and I enjoy doing this a little bit. It helps me in my teaching perspective. And the first question I always ask is, how much are you going to pay me? My husband would not ask that question. His question would be, how many times do I have to come and visit the clinic? So everyone has sort of their own way of looking at this exchange of information, and there's no way that you could possibly provide that information in the format and in the sequence of information you're giving to the IRB. You're going to use the information that's in the consent form, and you're going to answer questions that the potential participant provides to you. So now, if the opposite is true, if you are calling subjects, that would be subject to IRB review and approval, just like the advertisement. So I'd be using the same information, the same questions. If I was calling people in the practice where I worked, then the IRB would have to review and approve it. I hope that makes sense to you all. I love your questions. If you come across other scenarios that you might have heard about, if you're doing your internship now, and you've come across something interesting about the patient recruitment, please ask lots of questions. I learn things every time you ask me questions. And I will talk to you soon. Thank you. Bye.